Hello, students. I'm Dr. Timothy Brown, and I recently had the honor of delivering the keynote address at the second annual Health Equity Summit right here in Charlotte, North Carolina, hosted by the American College of Healthcare Executives, Greater Charlotte region. In this keynote, I shared 3 keys to sustainable health equity, practical, actionable strategies that every future healthcare leader should understand. As you watch, I want you to think critically about how these principles connect to your studies, your future roles, and even your everyday interactions. After watching, I'd love to hear your thoughts. How can you incorporate these 3 keys into your career, your community, and your commitment to health equity? Let's keep the conversation going.
I am super honored to be in this room today with so many passionate healthcare leaders that are interested in understanding this overall topic of health equity. And I'm really proud of the work that we've already done as we're continuing to move forward in our individual communities. Today I'm going to talk about something that's near and dear and passionate to my heart and share some overall tips that we can overall use to make it what we call health equity ingrained into the overall work that we individually do. We've had 2 rich conversations today, as you can imagine, with our first panel. And then we're speaking around the overall topic of teams and building high-powered teams. What a powerful overall session that we had. The leaders, they gave some great tips about how we can motivate individuals, how we can select the right overall individuals for your organizations. And then if you're having some of those issues and troubles around that, what you can do to kind of move those teammates to either a new department or to a new overall area. Another thing that we also talked about today was Helene conversation around Hurricane Helene, That panel also was a very, very powerful situation. One that was really near and dear to my heart as well as we were walking through that. I don't know if you can notice, and if you had a chance to kind of look at everyone's face that spoke on that overall panel, there's still a lot that's still going on in that overall area. So we want to keep our teammates in our hearts as we're pushing through, continue to reach out if we can. As Dan also said, if you can visit as well so that we can kind of push through that. This all reminds us that equity is not optional. It is actually a part, especially in a crisis. Equity is not optional. One of the leaders said during that overall presentation, he said, if everything gets thrown away, then that actually levels the overall playing ground for everyone. So if whether you're rich, your house gets washed away, or if you're in a poor neighborhood, if everything is just taken away, we're all on that equal playing ground. And I think that during a crisis, we can actually see how equity actually makes everything level. And then you come down to what we call the overall humane portion of what we need to really focus on as healthcare leaders, which is that person and the humane part of it. So here's the truth. We've had reports, we've had task force, we have data for decades. I can tell you stats throughout, and I'm not even going to give you any stats today, only because I know we've heard them over and over. Yet we still see Black women dying in childbirth in disproportionate rates. Rural communities with no access to care. People choosing between prescription and rent. Why? Has healthcare not progressed to the point where we can actually make that overall change? I believe it is because we're too often treating equity as a program instead of a principle. Sustainable equity requires culture, as it was said on one of the panels earlier. It requires courage and consistency. It has to become who we are in our everyday lives. I'll tell you about my lived experience. I don't claim to know it all, and I don't claim to be the expert in the overall field. But what I can tell you is what I've learned from the years that I've worked in. It's been over 2 decades in healthcare, developing programs, leading teams, advocating for underserved populations. I've seen equity from the boardroom, the break room, and the bedside. And what I've learned is you don't need a title to create impact. You need commitment. That's what we're about to explore, the overall commitment. So what does that really look like? After my years of experience of working through, I've developed 3 keys that I like to kind of speak on when we're talking about health equity. You can use these where you're using grassroots efforts or if you're in the executive boardroom. They all apply to each of those individual areas. The 3 keys include courageous conversations, Has anyone ever been to a courageous conversation or in a courageous conversation? Second one is proximity with purpose. Where you are matters. Who you are matters. What you say matters. And we'll talk a little bit about that in just a moment. And last but not least, micro action with macro impact. Those little small things that you can do, they actually add up to big things. All right, let's explore the first one. Courageous conversations. So I've seen a few hands around the room, so you actually know what this actually looks like. We've been in, we've had an opportunity to listen, to talk. But when you're talking about courageous conversation, you got to remember this. If we can't talk about inequity, we can't fix it. And too often we avoid those hard conversations. I heard during the panel earlier, speaking of after Hurricane Helene, those hard conversations, they're uncomfortable. No one wants to have that hard conversation, but remember the goal is not comfort. The goal is change. So in those hard conversations, we have to get comfortable being uncomfortable. Whether you're confronting bias in your hiring practices, talking to board members about access issues, or listening to patients' lived experiences, the most courageous thing you can do is tell the truth and create space for others to do the same. One of the biggest things I like to do is start asking, who's not in the room? Who should be here today? You look around, we have some empty chairs, it's totally fine, it's a Friday, totally understand that. But can you at least think of one person that could and should be here to be able to hear this information to take it back? If you can think of one, then it's your obligation and your job to be able to take that information back to that person. What aren't we saying that needs to be said? And then after you ask those two questions, I want you to listen and really listen. Who's not here that needs to be here? What aren't we saying? Hear it. After the hurricane, one team learned more than 30 minutes with residents, learned more in 30 minutes with residents than they had in 3 years of reports. Sitting down having that conversation let us understand that, hey, it wasn't medical treatment that the patients needed. They needed simple stuff. They needed communication opportunities. They needed food. They needed clothing. So they came to the hospital. It's amazing that they said the hospital was kind of like up on a hill. Everyone was climbing to get to the hill to get something. So after listening to the overall panel, we understood, well, maybe they didn't necessarily need medical supplies. They needed simple everyday stuff, water, food, clothing. Having that conversation. Listening changes their strategy. And for that entire team, they actually talked about it. It changed how they looked at and approached what was needed for the overall group and for the community. My challenge to you this week and as we move forward is have that one courageous conversation. It doesn't have to be a major conversation. It could be a water cooler conversation where you talk about maybe one thing you can possibly do to change and influence the overall status for your organization. Second one is proximity with purpose. Equity can't be solved behind a desk. We all understand that, right? It takes us getting out in the overall community. Simple things. We talked about it earlier. Dean even spoke about some activities that you can do in your community, but you have to get close because proximity builds empathy and empathy drives innovation, which is what we need. When you walk the streets, visit the overall shelters, talk to the families, you see the things differently and you see how they can be changed. The panel today, at Expeds, that we were talking with, they talked about being in the overall shelters. I think the gentleman here that was speaking was talking about how they created an opportunity for the community members to come and take showers. They wouldn't have known that had they not been in the community to know that, that's what the overall community needed. So that's what we're looking for. When you're looking at empathy and understanding the community, listen to what they're saying and actually provide what needs they have. How do we practice this? Let's talk about it. Volunteer regularly. I say regularly as often as you can. I know at many organizations they offer opportunities for you to get involved in. I remember when I was working in the call center for Atrium Health, even if I couldn't get out in the actual community, we were able to color, I think it was bookmarks for the kids and bring that information out. And we were able to fill out cards for the overall U.S. troops as well. Small things like that. Your local community, your local churches, things of that nature as well. There are plenty of events and plenty of places that you can be beneficial to be able to understand how your community works and flows. Ask frontline staff for feedback. If you're a leader, frontline leader, manager, supervisor, ask your staff how things are going with them. Spend time in the spaces where the gaps exist. I think about all the new hospitals being built all around Charlotte, and I still drive up and down Betty's Ford Road like, when are we going to get something out there, you know? When are we going to reach the people that actually need the overall help? Invite community leaders into your planning rooms, not just to advise, but actually to lead. They have great ideas. There are some great leaders out here that can provide some information and knowledge that we don't actually have, and they actually have the influence to influence others to move. Equity work is not sacred work, but it can't be done from a distance. You got to get close, you have to stay curious, and you have to be patient. Micro action with macro impact. Too often we wait for the big change as far as policy or legislation and funding. And I'm telling you, we probably won't have it in favor as we're moving forward for a little while, just to be honest. But change does not start from the White House. It starts in your house. You have to make that change. You have to make it yourself. Sustainable equity is built one decision at a time. One job offer at a time. One patient conversation at a time. When every person in your system feels empowered to act, and I think Seb actually said this earlier as well, even in small ways, the cumulative impact is enormous. When people feel safe enough to make a change, to speak up, then that's when things start to change as well for your organization. So what if we added a health equity question to every interview panel? What if every Monday huddle included one equity insight or action? What if our employee recognition program included people who go above and beyond for inclusion? What would your organization look like? What would our organization look like? You don't have to do everything, you just have to do something. And that's all we're asking, one thing, every day, and it all adds up. Today we really talked about a few things. Talked about teams, we talked about leadership in crisis, and now personal accountability. Remember earlier from the last panel, I think it was the Hurricane Helene, they talked about accountability as well. But here's the thread that ties it all together. Health equity isn't just a system, it's a mindset. It's not just a strategy, it's the story we choose to live out. And you and myself are part of that overall story. The question is, what role will you play?
Thank you so much for watching my keynote on the 3 keys to sustainable health equity. I truly believe that every student, every emerging leader has the power to shape a more just and equitable health care system. Now it's your turn. Drop your reflections in the discussion thread. What resonated with you from the conversation? How will you use these keys in your work, in your leadership, and in your daily life? I look forward to reading your insights and continuing this vital conversation together. Have a great day.